Having talked about the different attachment disorders that a child can develop due to the development of the secure attachment, or it can be the unsecure attachment. Now, when the child basically develops that unsecure attachment with his or her parent, it can basically range from different kind of behaviors. For example, it can be an ambivalent behavior, it can be an avoidant behavior in which the child is basically avoidant of his or her primary caregivers, which is quite of an abnormal view. And then we have the disorganized behavior, which is basically a mixture of ambivalent and as well as the avoidant behaviors. The ambivalent behavior, when we talk about it, it's basically the child has lost trust in the world that is surrounding him. He's going to have difficulty in maintaining those peer relationships, and he's going to become more unsocialized. As well as if we talk about the avoidant behavior, the child is going to be more friendly in that avoidant behavior, but he's going to avoid his or her primary caregivers. Now, having developed this disorganized behavior can be sometimes problematic for the child, for his development as well, and for being to be fruitful to the society as well. Developing those unsocial skills can be quite hindering for the individual and can be quite hindering for the child as well. Then we have the reactive attachment disorder. It's basically a full-fledged attachment disorder that the child or the adolescent has developed, and one should know what is the criteria when we diagnose someone who is suffering from this reactive attachment disorder. Although some adults can also suffer from this kind of a reactive attachment disorder, but the prognosis in adults is quite difficult and it's not quite good. When we talk about the children who are suffering from this reactive attachment disorder, we can work on these children and adolescents, and we can have much better outcomes in these children and the adolescents. So we should know how to diagnose these children, and how to treat and manage these children as well is very important. So we'll be discussing the treatment guidelines of people who are suffering from these reactive attachment disorders. So there are lots of treatments, different types, different modalities of treatments have been devised to basically mold the behavior of the individual and make him or her more fruitful to the society surrounding him. So we have a DSM-5 criteria for the diagnosis of this reactive attachment disorder. We'll be discussing the signs and symptomatologies that we're going to focus on when we are diagnosing an individual who's suffering from such kind of a disorder. Then the placement of a child with the reactive attachment disorder is again very important over here, and we'll be discussing that in detail as well. The reactive attachment disorders, there's a marked disturbance in the social relatedness as evidenced by the persistent failure to respond to most social interactions. So one should know how to basically cater or deal with these social interactions. Having no social interactions is going to hinder the individual's life at most. Hypervigilance or ambivalence is sometimes observed. That is basically an aggressive behavior is observed in these individuals primarily. And then we have the diffused attachments. They are shown by the sociability. The inability to exhibit the selective attachments is again very important over here. And before 5 years of age, the pathogenic care is available, and one should know how to deal with these reactive attachment disorders before the 5 years of age. As the age group increases, as they enter into their adolescences or in the adult life, it is very difficult to change the way in which a person is behaving. The mood disorders cannot be changed quite frequently in these individuals. So one should know how to deal with these RADs or these reactive attachment disorders at most initial time as possible. The types of treatments that are available for such kind of children, attachment-based behaviors or the attachment-based treatment modalities are sometimes available. They facilitate the attachment through nurturing or structure. Then we have the attunement and empathy. So empathizing with the child and making him know that I know you have been suffering through this kind of an attachment, a development of the insecure attachment, and how to basically deal with the problems is again very important. Make the child have the insight of the problem that he's facing. Be more supportive, positive effect, and reciprocity is again very important. Holding to reduce the alarm reactions. So basically, the parent counseling is again very important component over here. You have to basically counsel the parents as well as counsel the child along with this treatment modality that we're dealing in right now. The example is theraplay. There's again, it has its own significance over here. Then we have the trauma-informed treatments or the trauma-informed therapies, in which we have the psychotherapies, we have the cognitive behavioral therapies, we have the play therapy, we have the art therapy. So all of these therapies are going to basically lead to a catharsis of the child, making him catharsis or making him express his feelings through the play or express his feelings through the art is again very important over here. The cognitive or the thinking process of the individual or the child is again very important over here when we talk about them. The DSM-5 criteria is again very important for the diagnosis of the individual. Emotionally withdrawn behavior towards the adult caregiver is a significant finding that we are going to inculcate in an individual. They're manifested both by the following: rarely or minimally seeks comfort when distressed. So it's basically an avoidant behavior that is seen in these individuals. And then we have rarely or minimally they respond to the comfort when they are distressed. So this is the behavior that is going to be commonly seen in the individuals who are suffering from this reactive attachment disorder over here. Then we have the persistent social or emotional disturbance that is going to be seen in these individuals, that is characterized by two of the following: the limited positive effect, the minimal social and the emotional responsiveness to the others is seen in these individuals. And then we have the episodes of unexplained irritability is going to be more of the aggressive type. The sadness or the fearfulness is also going to be seen in these individuals. And then we have during the non-threatening interactions with the caregivers, even then he's going to show the aggressive behavior that he's suffering from. Placement of a child with RAD is again very important. It's quite tough in most of the times. Often it is quite disrupted. The disrupted placements further exacerbate the issues. So making the child more socially friendly is again very important. To place a child back is again very important. RAD has an impact on the family as well, and one should consider counseling the parents and the siblings as well. Training is very important for these adoptive or the foster families. So if there is some sort of an adoptive section that we're dealing with, or some families are fostering that child, they should get the knowledge about this RAD behavior or the reactive attachment disorder that the child was suffering from. So this is how the child who's suffering from RAD looks like. But basically the other picture is showing the child who was previously suffering from RAD, but due to the art therapy or the play therapy, the child can be more significantly placed in the society and make these children more fruitful to the society as well. So in this section, basically, we summarize the reactive attachment disorders that can develop due to the development of the unsecure attachment with the primary caregivers, and how do we go and deal with such kind of children. So that is the end of the section. Thank you for watching sqadia.com.